And we're so pleased to have Carrie Templeton with us today. Carrie is the program advisor for the HERO Fund within the Louisiana Department of Health. The HERO Fund was established by the Louisiana legislature to increase education and training opportunities and to strengthen the workforce pipeline for high-demand healthcare positions across the state, academic and health industry partnerships. Previously, Carrie served in hospital leadership positions in the Lafayette region, including administrator of Our Lady of Lourdes Women's and Children's Hospital, Lafayette General Surgical Hospital, as well as administrator for Women's and Children's Services at Lafayette General Medical Center. In that time, Carrie oversaw multi-million-dollar construction projects and established her expertise in business development, physician relations, hospital operations, and maternal child health services. And I can say personally, I've met with Carrie on a couple of different occasions. She has really hit the ground running with the HERO Fund. And I know that she's going to do an excellent job with this. We're super excited about her leadership. And with that, Carrie, I'll turn it over to you.
Wes. I appreciate that very nice introduction and welcome everyone to this call. Thank you for joining us for this webinar. As Wes mentioned, I'm the program advisor for the Healthcare Employment Reinvestment Opportunity Fund. I joined the Department of Health team back in October, and I'm really excited about this opportunity, and I'm excited that you're interested enough to join us on this webinar today. So thank you for being here. My goals today for you all are to share with you the HERO program highlights, tell you a little bit about the background in the program. Also, we'll review the HERO application so that you know how to get to it and kind of the major components of it. I also want to make sure and share with you all who are eligible organizations to apply and how the submission process is gonna work. And then finally, make sure that we leave today that you have key dates, contact information. And as Wes mentioned, if you have any questions, I'd love to address as many of them as I can on this call. But if not, you can always follow up with an email following this. So I'll share that information at the end of the talk. Okay, to give you a little bit of background on the Healthcare Employment Reinvestment Opportunity, this legislation was originally passed back in 2021, and the legislation established a fund to increase the workforce capacity for high-demand healthcare jobs. It was expanded on recently in 2024, but in 2021, the program was administered by the Board of Regents. And in that time, the Board of Regents awarded $4 million in funds to a project in each of the 8 regions to increase the healthcare workforce. And it was successful, but it was successful in a smaller degree and in a lot of discussions with healthcare partners, including the Nursing Home Association, the Hospital Association, and others. The idea was, how do we expand this opportunity and make sure that the training programs that are being funded really match up to jobs within the state that are in high demand across our healthcare organizations. So in 2024, that legislation expanded the fund and also shifted the responsibility from the Board of Regents to the Department of Health, which was where I come in as along with a few of my other colleagues working on this program. So this legislation, the purposes of the legislation are to increase capacity for education and training for high demand healthcare jobs, but we also are looking to increase access for dual enrollment and career pathway programs between high schools and career training programs. This legislation also is incentivizing strategies for healthcare organizations, including long-term care groups, nursing home associations, to help develop those career pathways and even like apprenticeship programs, which seem to be a little bit more common in other states, but are a real opportunity here in Louisiana. We also want to use this fund to raise awareness about healthcare careers and reducing barriers of access to healthcare programs, including financial obstacles. And then also internships. Internships are a big opportunity and expanded purpose of this funding with licensed healthcare providers. Applying organizations can include, now I'm talking a little bit about eligibility for applying. In the past, it was only education and training programs that applied for this funding opportunity under the Board of Regents. Under the HERO program now, it's expanded. So while healthcare training and education programs can apply. It's also open for healthcare industry partners to apply, and even possibly not-for-profits. The thing is, you just have to have two partners. So for example, if an education training program applied, it needs a health industry partner, and vice versa. If a health industry partner, say, an organization that you represent on this call wants to apply for the HERO funding, you're eligible to apply, but you need to identify an education or training partner that you're going to work with in this grant. So I'll talk a little bit more about that in a little bit. But the other piece of this, the requirement for the HERO funding, is there needs to be a match equal to the grant request. So, for example, healthcare partners may provide clinical instructors or spaces, classroom spaces, even tuition assistance or loan forgiveness. Those are examples of in-kind matches that health industry partners have to provide. I believe I wouldn't be surprised if several of y'all's organizations are already doing that. So we want to use those funds and that investment currently being made to then grant money for education and training programs to expand the number of students that they're enrolling in their programs in those high demand areas. So what we've done, the application for the HERO program is now live. There's a website, and this is a link of it. If you Google LDH and HERO, you should be able to get to it as well. But this is the web page that we've established for the HERO landing page. Let me see. I'm going to see if I can go to the link here. Do you all, let's see. Well, I'm having trouble actually getting to the link on the way I have this set up, but if you see, this is the web page for the HERO landing page, and it really explains everything about this grant opportunity. So when you want to really get into the detail, just go to the landing page. You'll see here, this area talks about purpose, and that's the real important area. It really explains how we're going to evaluate grants based on these purposes. And some of them I outlined earlier in this presentation. So the purpose of the funding is how we're going to evaluate grants as people apply for them. Also on this website, it talks about the eligibility, which I discussed, but there's also a downloadable application. So again, if you go to the HERO landing page on LDH, you'll find that actual application. It's pretty straightforward. It talks about a proposal of what the application is for. You know, we really want organizations, say for example, you really struggle to hire LPNs, and you want to apply for a program for grant funding for us to pay for an education training program for LPNs that you then are going to partner with and either provide that clinical training experience, or maybe you want to provide some tuition assistance for people going through that program that maybe are already your employees or that you'd like to hire afterwards. Those are examples of the types of programs that we're looking to grant awards for. Also on this website, and I'm sorry that I'm not able to pull it up on the screen the way I have it set up, but if you go to the website, it also talks about key dates. So I mentioned before, the application, which is loaded on this website, opened on December 2nd. The deadline for the submission of application is January 31st. So it's 60 days that the application will be posted. Soon after the applications close on January 31st, we're going to have an evaluation committee review the applications. And our goal is to be able to announce those that are awarded by March of 2025. The funding that's awarded is going to be provided as a reimbursement to the organization that applies. So that's the way the funding is set up. And there's a very good amount of funding that has been set aside for the HERO program. Right now, the funds that we have to work with are $15 million, which is very significant. As I mentioned before, the original group of grants that were provided were awarded up to $4 million. So we've got triple the amount of money now that we are able to grant. And while we don't expect to grant all of those funds in this first round of funding, we hope to be able to support a good amount and then be able to come back and continue to re-offer this funding on an annual basis, if not more frequently than that. So I mentioned before some of the key dates and timelines. We have been working on outreach. This is an example of our outreach, trying to get to as many of our healthcare industry partners as possible to make sure everyone's aware of this opportunity. December 2nd was the date that the application went live and our landing page went live on the Department of Health. The application is due January 31st. And as I mentioned before, February will be our time frame for our evaluation committee to review our grants and ideally be able to announce awards, as I mentioned, in March. I wanted to share with you an idea of what this might look like for us in Louisiana. This really is the first time, the way we're doing the HERO program in this iteration, it's the first time we're doing something like this. So we're fortunate that our legislators, along with the different stakeholders who put together the legislation, also worked with some legislators in Kentucky who passed similar legislation a year before us. And so Kentucky has a great example of funding similar types of grants and doing so very successfully. Their legislation was passed in 2023. As I mentioned, ours was 2024, but they were able to award almost $12 million in funds for their program. Those $11.8 million were matched by health industry partners, and there were 33 different programs that benefited from the funding. For example, they may have had 7 different RN programs, and maybe there were 10 different LPN programs with different with different education partners across the state. And then it also says there were health industry partners, obviously, that matched all of those programs. So similar to the Kentucky situation, what we're expecting is that we're going to get applications from grants anywhere from $10,000 to possibly $1 million, depending on the size of the training program. And so we want to make sure this program is open to every size of participants interested. And also, we're going to make sure that we have a lot of geographic distribution of these programs, because people in all of the regions of the Department of Health, in the rural areas especially, we want to make sure we expand the training opportunities there. Kentucky has experienced a 5% increase in enrollments for their health-related programs, and it's seen a significant increase in their associates programs, their LPN and RN programs for underrepresented minority students, which is also a really great thing for their healthcare workforce. So these are some of the examples of what we hope to see when we go through this program and this funding opportunity with HERO here in Louisiana. So with that, I've given a brief overview of the program. I think it may be most beneficial to answer questions if you all have some specifics, to make sure I'm, sharing this opportunity in a way that meets your workforce needs. So with that, Wes, and I'll hand it back to you.
Thanks, Carrie. Great information. And we'll open the floor to any questions the group may have. And I'll go ahead and get it started while people are thinking of their questions. If a facility knows that we have, let's say, $50,000 that we want to dedicate to increasing our workforce, but we're in Baton Rouge, we're not really sure who our education partner would be. Does LDH have the ability to partner you with someone or kind of match those groups?
I think we can do that. We've gotten, over the last couple of months, we've become very aware of the different training programs. So, and there's quite a few that have expressed an interest in doing offsite locations. So yeah, if anyone is unaware of training programs near their geographic area, or people who may want to partner them, they could absolutely email me or email here at this HERO email address, and we would be happy to try and match them up with training partners to do that.
And I know there's kind of a definitive amount that's in the fund right now, but as far as is there any kind of cap on how much matching funds the LDH will do right now?
There isn't. It's really open. The legislation is very broad, and we intended to keep it that way for now, just because we want to encourage innovation and not exclude potential partnerships. So it's very open at this moment.
Any other questions from the group?
I will say this, Wes, as if there's any other questions that come up, but one of the things we found is we have very good resources in terms of associate's degree programs. I think we have contacts with all of the LPN associates programs, RN programs, other allied health programs. But one of the things we don't have a really great listing of is other certification programs for like CNAs, some MAs and things like that. So, um, you know, we really are leaning on the partners, the industry partners, to kind of do a little, to know who they've been successful in hiring with, and maybe try and reach back out to those educational partners and say, hey, let's do a program together. And so that's what I just want to encourage anyone on this call. If say in the last year, you notice that several of your CNAs are coming from a certain program, we would encourage you to reach out to that program and say, look, we'd like to continue hiring and create more capacity for your program. How can we partner in this grant opportunity to do that? So that's kind of an example of how I'd say that for organizations on this call, they might be able to, come up with a good application and proposal for the hero funds.
Well, I know that you and I kind of had a conversation before the webinar began about CNA training programs and how a lot of facilities have their own in shop. And I guess the question would become that since they're kind of one and the same, they're both a healthcare provider and they're kind of an educational provider at the same time. Does that qualify, or do they need to go out and find an outside entity?
Yeah, at this point, it really does not qualify because it really has to be a partnership. Now, if there was a foundation or a not-for-profit that would be willing to match funds, then that would be a partnership and that would qualify. But it's kind of a similar situation with some of the EMS organizations. They a lot of times train their own employees, and so it doesn't really allow for a partnership if you just stick within the same organization. But as long as there are two organizations partnering, then that is an eligible application and proposal.
We've got a couple of questions that have come in, and Carrie, I don't know if you're able to see them or not. But one is, if a facility has an immediate jeopardy in IJ within the last 18 months, would they be disqualified?
There is no language in our grant that says that there would be a disqualified, so no.
Okay. And then the follow-up question was, so the healthcare facility would have to match the grant amount. And so I believe that's correct. I mean, whatever amount you're willing to put, you basically get reimbursed, I believe is what you said, through LDH.
Yes, but I do want to say, it's not just monetary amounts, it's also in-kind donations. So if your organization offers tuition assistance or reimbursement, and say you offer, I don't know, $5,000 tuition reimbursement for maybe an LPN, then that $5,000 can be an in-kind match for the Hero Fund. So if you have an education training provider that you work with and they want to expand some of their enrollments or, bring in more students, then you can use your contribution of that $5,000 per student, say, to create the match for a proposal under Hero.
Yeah, I think we have a statement in the chat that kind of illustrates that. And the statement is, so would it essentially be as simple as proposing we have X number of CNA scholarship money and we're partnering with a community college, and if selected, Hero Fund would match that proposed amount in the reimbursement format?
That is a very simple way, and
Mhm.
and that makes a lot of sense. In
Okay.
fact, that's what Kentucky's program, it was all scholarships. So yes, absolutely.
See, I think I have one more in the Q&A. If your company and facilities are not for profit, would we still need an educational partner to qualify?
Yes, it still has to be a partnership. If not an educational partner, a not-for-profit. Some foundations and different groups like that are interested in, helping support these types of efforts, but you do have to have a partnership.
Any other questions? There must not be the ability to, I think we may have everybody on mute. So if you have a question, either type it in the chat or the Q&A, and I'll be sure and read it. All right. Carrie, one more time, will you go over those deadline dates?
Sure, I will.
Okay.
So again, the notice of funding is published live on our Hero landing page, and you should be able to just Google Hero and LDH to get there. If you have any problems, please feel free to email me. I've left the Hero. It's hero@la.gov. You can contact me that way, and I'm happy to help. Um, so the notice of funding is published. This application period is 60 days. So it's going to be live and open until January 31st. And that's when the submission deadline is. That's really the key date. So please make sure if you have any questions or you're trying to put something together, feel free and reach out to us via that Hero email. In the meantime, we've been fielding a lot of questions and clarifying things as organizations have reached out. So please feel free and do that leading up until the application closing date. And as I mentioned before, the goal of this is to continue to do this funding on a regular basis. So this is the first round of Hero funding. We will definitely be doing it again within the next year, if not more frequently, depending on the success of our program. So, we've got a lot of funding that we need to make sure and grant out and distribute in a way that really increases the high demand healthcare workforce within the state and retains those graduates within Louisiana healthcare industry partners. So that is our goal, and we're going to continue to work through this process and refine it through further rounds of grants as well.
Well, Carrie, I can't thank you enough. I know that there is a tremendous need for increased workforce, not only in nursing facilities, but also throughout all of healthcare. I guess that's another important thing to remember, that this is not just a nursing home program. This is open to all healthcare. And so there will be a lot of competition for these dollars. And so I strongly encourage you that if you're interested in this program, and if you have questions, please send those questions to Carrie. Please be mindful of the deadline dates to get your applications in. And I know that this will go a long ways to hopefully addressing some of those workforce concerns. And so if we don't have any more questions, Carrie, really thank you for your time. Really appreciate the information. If you have any questions, please email Carrie, or you can email me here at LNHA, and we'll be sure to get those questions to Carrie. Carrie, thanks again. Appreciate it.
Thank you so much.
And I